I'm Danny West and you're back with another episode of the Soapbox, your patient education station. And this week we are talking about ankle dorsiflexion, okay, and why it's important to you and should be. So when we're talking about the ankle, just know we are also talking about the knee, always. Because if the ankle doesn't move well, it puts a lot of pressure on the knee joint. And I can't tell you how many patients I saw just in the past month where they were having like chronic ankle or knee issues and nobody really checked their dorsiflexion and weight bearing. So again, it's super important and we need a certain amount of range at the ankle joint in order to prevent injury, okay, and also recover from one. So what is dorsiflexion? So basically, the ankle can do two main movements in this plane. So it can plantar flex or point, and it can dorsiflex, which is bringing it back. Now, we need this type of bend at the ankle for important things like walking, going down a stair. The ankle needs to be able to bend to a certain degree, again, to take any pressure off the shin and or the knee joint. So if you're lacking a bit of dorsiflexion, maybe on one side or maybe on both, you can do a lot of good prevention just from trying to increase your dorsiflexion, okay? So we're gonna go over a quick test and then a quick easy way of how to treat it if you do notice a little bit of restriction. So my favorite test for this is called your knee to wall test. So you basically set up a ruler, okay? I've set up a box just as like a makeshift wall here. But basically in clinic, I wanna see how far you can get your foot away from the wall, touch your knee, still keeping your heel down. And I would say, okay, like that's pretty good. I'm gonna try to move back a bit. And you might start to see their heel start to come up, in which case they've gone too far. So again, come right in. Ideally, hips should be totally square and foot is in neutral, okay? And then I would take the measurement off the big toe. So I would say, okay, this person got whatever, 16 centimeters. But the important thing is also do your other side, okay? There's no hard and fast rule of like, well, Danny, like how many centimeters should I have? It's all relative. So if I had a really tall patient, they're gonna have a longer shin bone. So I would expect they can get a longer reach than say an 8-year-old. So it is all relative. I always make sure, okay, how tall is this person? How long are their shin bones? And then secondly, do they match both sides, okay? So I'm always gonna compare it to their good side, or maybe both sides are really stiff. What I don't wanna see, so for example, I was helping out with some testing for elite level dancers a couple weeks ago, and I can't tell you how many of them could not get double digits on this. And that's a huge issue. So the rough guide for dancers, they should have between 11 and 18 centimeters. And they weren't even getting 10. So that's just telling me, okay, like this is something like they should work on because it's gonna affect how they're landing from a jump, that shock absorption through the ankle, and they're probably gonna end up with some ankle, shin, and or knee issues because they don't have that range there. Also dancers, notice that this is our demi-plie position. So if I don't have a nice juicy demi-plie, I'm not gonna be able to land and take off from a jump very well, okay? And that can lead to a lot of issues. So when you're doing this at home, first off, do both sides match, okay? You should have equal range both sides, and if you don't, you might need to work on that sticky side. So some people do have just chronically tight ankles. Some people, maybe you injured and you never rehabbed fully. So again, dorsiflexion we want to make sure is restored to promote proper movement mechanics, okay? So we have the talus here, okay? That is the bone or the platform that the two shin bones sit on. And when we dorsiflex, that bone should be able to slide and glide backwards. But sometimes, for whatever reason, maybe tight muscles, maybe tight joint, it gets a little stuck. So when you're doing this, notice, what do you feel? Is it just like a pull in through the back of the ankle, or do you get a bit of a pinch in through the front, okay? If you get a pinch in the front, it could be, again, that talus just isn't sliding and gliding as nicely as it could be. So here's a really easy hack of how you can help improve your dorsiflexion without a physio, okay, and also gently and ideally pain-free, okay? So we have these little magic bands, and we're gonna do more with this, again, when we talk about the knee joint, because there's some really cool things you can do with this. So this one, little shameless plug here, this was from Edge Mobility Systems. It's called the Edge Mobility Band. It basically was created by this guy named Dr. Urson Religioso. Urson, I hope I said your name right. But he is a physio out of the States, and he has a blog and a company. You can find him by looking up like the Modern Manual Therapist and or the Eclectic Approach. And I took a course from Urson, and he basically had all these little tips and tricks of like just some ideas of how you could use the band, among other things. So this isn't something I just dreamt up. I wish I did, but this is a culmination of some of the courses that I've taken. Also, when you see this motion, it's kind of based on the Mulligan technique, which is, we call it like an MWM, which is a mobilization with movement. So this guy, physio, Brian Mulligan, again, came up with this system of treating in which he said, well, why don't we stop just like mobilizing a joint with the patient laying there? Why don't we actually get them to move as we try to mobilize that joint with movement? So what this is gonna do is we're actually going to put the band over the talus, and what we would do in clinic is almost try to slide and glide that talus back, okay? Again, to allow for the tib and the fib or the shin bones to come forward, allowing for that dorsiflexion. This is your take-home physio, basically. So I'm gonna take the band, and the way to landmark this, I'll do it facing you first and then turn sideways, is you wanna find the crease of the ankle, okay? That's basically your true ankle joint or your talocrural joint. So I'm gonna find the crease of the ankle, I'm gonna put the band right over the ankle joint, and I'm just gonna cross the band in the back, and I'm gonna kneel on it. Then I'm gonna step forward so that band is taut. Now again, just like the knee to wall, hips are square, foot is in parallel. I'm gonna lunge forward as far as I can, trying to get to end range. That's key. I can't just kind of oscillate through this mid-range here, okay? For it to be effective, we need to get to end range. So again, if I quickly do that from the side, find that ankle crease. I'm gonna put it over the crease of the ankle, kneel on the band, like so, and then just step forward so the band is taut, and I can kind of reposition it too if it slipped off. And again, I want to kind of go as low as I can go. And notice the band is kind of angled. Again, that's what we want. If it's up here, it's not going to do much. It needs to be angled right across the crease of that ankle. And you would kind of lunge forward to end range, trying to keep the heel down 10 to 15 times, okay? So that is basically your take-home physio, because that's what we would do in clinic. Now, if you're doing that, you're getting a lot of pain, sharp pain, please stop, okay? It's supposed to be a gentle kind of mobilization. So if you feel any pinching, again, hold off and maybe do go to a physio and ask if this is appropriate for you. But I did it in a few classes a couple weeks ago, and most people were able to do it themselves, relatively pain-free. So that's what we want when we're doing this. So again, that's your little MWM, or mobilization with movement, okay? It's based on a Mulligan technique, and super easy. If you can also get these bands through Amazon, okay? And there's this other brand that I ordered, works just as well. You can just Google kind of Serious Steel Fitness or Serious Steel Bands, and I actually got them in a pack of 2 off Amazon. Thicker than a TheraBand, and they work quite well. So you should be able to find these kind of at different suppliers as well. Super easy. We're also going to be able to use this with the knee, so stay tuned for that, because they're a really quick and nifty tool that I use in clinic, and also patients use quite easily on their own at home. So that's my little rant on dorsiflexion today. So go home and check yourself so you don't wreck yourself, and we'll see you in a couple of weeks when we move up to talk about the knee. Thanks, guys. Bye.